for the entire Philippines to shift to modified general community quarantine to address the country's hunger problem.
Yung ating quarantine restriction na ginawa since March of 2020, ang nagdulot po nito na total income loss na 1.04 trillion pesos in 2020.
The Health Department logged nearly 1,400 new COVID-19 infections today, and that brings the country's caseload to above 552,000, some 28,000 of which are still considered active.
Patuloy po ang pakikipag-ugnayan natin sa iba't ibang rehiyon upang magkaroon tayo ng sapat na representasyon ng mga sample sa buong bansa at maging malinaw sa atin kung ito bang mga dumadaming kaso, bunsod ba ng mga bagong variants na ito. Pero sa ngayon, hindi pa po conclusive ang findings.
Malacanang is studying the recommendations of its economic planning managers to place the entire country under modified general community quarantine or MGCQ by next month. Now, apart from Metro Manila, 7 other areas in the country are still under a stricter general community quarantine or GCQ due to the continuing high rate of COVID-19 transmission.
The Interagency Task Force on Emerging Infectious Diseases has allowed the reopening of more tourist spots and businesses in GCQ areas to stimulate economic activity and address poverty. But what are the government's measures to contain the health crisis while it is reviving the economy? We discuss in this episode of The Chiefs.
And welcome to this Tuesday edition of The Chiefs. Of course, with us in the studio is Robbie Lampayo of One News, and joining us online is Luchi Cruz Valdez, the head of News 5. Joining us in a while will be Ana Marie Pamintuan of the Philippine Star. Luchi and Robbie, happy Tuesday.
Hello,
Happy Tuesday.
Hi, Robbie.
Okay.
Happy Tuesday.
Well, I think we have to go straight to our guest kasi mahirap hagilapin to. At ito, nakuha na natin.
Ay, umiilag pa.
Umiilag. Bagamat araw pa sa kanilang lugar.
Good evening.
Good evening po. Of course, we're talking about Dr. Eric Domingo, ang pinuno ng Food and Drug Administration, ang the primary agency tasked with approving all vaccines coming into the country and being administered in the country. Doc Domingo, good evening and welcome back to the Chiefs.
Hi, good evening, good evening, Ed, good evening, Robbie, and
Good
Luchi.
evening, Usec.
Thank you, sir, for joining us. We've been looking for you. Well, sir,
Yeah, I've been very busy. I just flew
I
in
understand,
from that meeting last night that you were showing earlier.
yeah, that meeting. Yes, sir. Well, quite a few questions we have for you. First of all, yung COVAX vaccines appear to be getting delayed because of paperwork. So for all intents and purposes, there's a big chance na maunang dumating yung Sinovac vaccines na slated to arrive on February 23. Pero wala pa siyang approval ng FDA for an EUA. How close are we to giving Sinovac an EUA, if at all? And what if it is not approved by the 23rd?
Well, if it's not approved by the 23rd, they cannot bring it in or use it. No? Kasi you need an authorization to be able to use a vaccine in the Philippines. I cannot give a date kasi, our experts are really busy at it. We got updated data again 2 days ago. So they're looking at that, at the safety and the efficacy profile. And then our regulators at FDA who are checking the quality, the manufacturing, the stability of the test, had a meeting with the Sinovac last night. And they were asking for, I think, at least 4 more documents. No? And Sinovac promised to submit this within the week. Of course, depending on how satisfactory everything is, dun ko lang mabibigay ng makaka-make ng decision on the application. So I cannot give a date on when that will happen. I want to finish it soon. I want to make a decision at least siguro by the end of the month. But I'm not giving myself naman that this February 23 deadline. No?
Yes, sir.
Some things just really have to be appreciated really well before you make a decision on them.
Yes, sir. Kasi we got the
Why are
impression...
you taking longer with Sinovac compared to the other drugs? I mean, the other vaccines.
Yeah, like with Pfizer, we were able to do it in the 21 days that we set, and also
Yes.
AstraZeneca, and that's because these two drugs have what we call from what you call stringent regulatory authorities. Yeah, and when you have that, it means that it has, for example, from US FDA, UK FDA, even
Yes.
WHO. So pag nag-submit yan, kompleto talaga yan eh. Nanggaling na rin kasi sa mas stricto pa, no? Kesa sa atin. Plus, we ask them to submit to us all of the evaluation reports and the question and answer portions of the previous evaluations from those countries. So pagdating dito sa atin yan, nasala na yan, and it's a lot easier to appreciate everything.
So
Usec, what?
it's not enough that it was used already, say, in Sambasa, Indonesia, or sa Turkey. Hindi yun sapat. I mean, that's not a high enough standard. Ganun ba yun?
Oo, hindi eh. Kasi like Turkey and Indonesia, these are not considered stringent regulatory authorities. No? So which means we have to take a look at everything, and then of course the product. Yung gusto natin makita, for example, na yung product na ginamit sa India is the same as the product na ginamit sa Turkey, and it's the same as the product that will be brought here. And for that, we have to look at all of the specifications.
Okay, Usec, what about the Russians? Where are we with the Russian vaccines, particularly Sputnik V?
Yeah, I think that one's even going to take a little longer. No, if I say that yung sa Sinovac we're like asking for 4 documents, I think for the Sputnik V it's like 14 documents, no, that they still have not submitted. Meron din sigurong lost in translation. Minsan yung format nila iba, tapos minsan yung inihingi namin pagbalik iba naman yung naibigay. It's very difficult sometimes, and our team has had several meetings with them. Hopefully the last one nagkaintindihan na siguro talaga what data we're asking for, and hopefully they submit it soon so that we can take a look at it.
Sir,
Kasi it has gotten approval from 22 countries, no, according to Mr. Dmitriev, who we had as a guest a couple of days ago. So it's that again. That's not enough, apparently.
Yeah, kasi that's true. If you look at the list of 22, none of them is from a stringent regulatory authority. It's from mostly countries from Eastern Europe or Latin America, but not classified by the WHO, for example, as a stringent regulatory authority. And of course, some things kasi must be submitted that is very particular to us. Yung stability data, for example, the labeling that you will use when it gets here. Na bawat country may sinasubmit sila na hindi naman porke hindi hiningi sa ibang bansa hindi na natin hihingin, no? Because we follow WHO standards. Although I have to say the Philippines is not it's not counted as a stringent regulatory authority, but for the EUA, which is the first time we're doing this in the country, we're really following WHO standards.
yes, sir. Sir, I'll go back to Sinovac kasi 23rd is exactly a week from now, and you're still looking for 4 documents from Sinovac. So I suppose in all likelihood, baka maunang dumating ang 23rd bago matapos yung processing.
Oh, well, marami nagtanong sa akin yan. I said it's probably a 50-50 chance. No, it's really it doesn't depend solely on me. No, if I'm forced to make an early decision, then I'm going to be making a cautious decision. No, na siguro wag muna. Pero I'd rather wait and see if they are able to submit everything that we require, and then make a decision based on that. Depending
Yes,
na
sir.
talaga sa kanila yan kung kailan makukompleto.
Yes, sir.
but
We also ask about Sinovac kasi we are under the impression by Secretary Roque that pwedeng i-import dito at i-store muna yung vaccines until mabigyan ng approval ng FDA. So apparently, not even importation will be allowed until the EU is granted.
Yeah, well, the DOH is having some difficulty with that, importing it and then bringing it here. And then, paano nga naman kung hindi ma-grant yung EUA? What if our experts decide that it's not it's not a good candidate vaccine? tas nandito na, and then you're paying, storage, and how will you account for that? So it might be a difficult proposition. So I think they would like to wait for the decision.
Yeah, but nonetheless, sir, two things to clarify, no, dun sa mga sinabi rin ni spokesman Roque. One is, he did say that, no? He said, it might be unwieldy, but this is what he said. He said, pwede naman natin i-store muna dito eh. Tapos kung di makuha yung EUA, di hindi natin gagamitin. So the first question is that still justifiable under our protocols? Is that still a legal way of looking at it? The other side to that is they also brought up compassionate use. We wanted to ask as well, could you explain compassionate use again? Because parang the last time we were briefed on compassionate use, we got the impression that this applied only to small batches, if not special cases. But this time, as being pointed out by some other experts, they're saying, parang ngayon ko lang narinig ang compassionate use for commercial volume na shipments.
Oo, hindi pwede yun. Compassionate use for a public vaccination program, hindi pwede yun. Not when it comes to hundreds and thousands. I mean, of course, I'm sure you probably might to ask me a little about compassionate use. I've granted one. But not in this volume. Plus, this vaccine is already has a pending application for an EUA. So might as well wait for it. No? Why get it earlier when it has a pending EUA? And there's going to be a decision soon in the next few weeks whether it's a yes or a no. Kasi mahirap naman, di ba? Paano nga naman kung no siya later? Some countries have done it. Kaya yung iba, once approved, biglang magbabakuna the next day kung nakita niya. Kasi nag-store na sila ng vaccine and then while it's undergoing FDA authorization. But I can't say. In fact, I haven't seen the recommendations of the experts yet. I'm banging on them and then asking for them to give me their findings, and I really cannot say which way it will go. No, but I'm just giving them maybe 1 more day, 2 more days before they submit it to me, so that I can make a decision on it.
Sir, we have
But
Anna Marie
haven't you
Pamengkuan.
granted a compassionate use license to the PSG?
Yes,
Di ba
but this
lumabas
is
na yun? Yeah.
this is a very small number. No, this is like for 5,000 people. Plus, the vaccine does not have an EUA application here. It's a vaccine that's approved in China. It's not. They're not applying for an EUA here, and then they're donating it to the PSG.
Yeah.
And since the FDA will not guarantee that, no, we did not at all. No, when we talk compassionate use, we do not evaluate it. It's up to the doctor to be responsible for it, and the commander of the PSG hospital has taken responsibility for using it.
Usec, I will bring in Ami Pamituan, but I just want to quickly follow up on that because I don't know if I got it right, but it seemed like a contradiction unless I'm mishearing 5,000 doses or 10,000 doses for that matter as hindi commercial volume yan. Pasok yan sa maliit na volume that you usually associate compassionate use for?
Yeah, no, this is a small volume. No, this is not a public program, and it's a small group that everybody can be named and listed, and they will report to me whoever they used it on, and then what the outcomes are.
Okay.
So when I say a relatively small group, defined group of people, hindi siya yung 100,000, 200,000 for a mass vaccination program.
Pero Dr.
This is
Domingo,
sorry, yeah. Go ahead, Ami. Yeah.
Dr. Domingo, hindi naman yung size yung pinag-uusapan sa compassionate use, di ba? It's the need. Hindi ba
Yes.
dapat may sakit ka para ka makakuha ng compassionate use? Wala
Well,
naman
in this
sakit yung mga di ba? Yung mga sakit ba yung PSG? Can you explain us, ano ba yung basis for compassionate use? Kasi yun ang sinasabi ng mga tao na it's being used as a way to go around the requirement for an EUA
Yes.
first.
Right.
Ano
Yeah,
ba yung
well-
parameters for granting compassionate use? Kasi ako, as
So,
far as
number
I'm
one-
concerned, kung matanda ka, may sakit ka, you get compassionate use, you can import even cannabinoid, di ba? Under,
Yes.
Yeah.
Yeah, you can get compassionate use. Kasi dati kasi limited to cancer, HIV. Yan ang mga compassionate use natin. Meaning, merong drug abroad, na-registered abroad, pero hindi available dito. Sa COVID-19 kasi, dinagdag in June, and there was a DOHAO, including all COVID-19 drugs. that may be experimental, under investigation, that may be that's not available here. So in this case, ang justification kasi ng PSG for this is that number one, unlike all of us, wala naman silang choice, hindi sila pwedeng mag-social distancing, hindi sila pwedeng magkaroon ng mask at face shield lagi kasi pinoprotektahan nila yung presidente kung saan pumunta at lagi silang nakaka-expose. And of course, there's that chance of infecting the president or infecting dignitaries that the president comes in contact with. So they said that they had a donation of vaccine enough for all of the PSG. It's not licensed here, but they're not seeking registration. And the requirement din kasi is that the doctor there should be a list of doctors who will do the actual use of the medicine. They have to list them. They have to list all the patients it's given to, report all the outcome, and it's very expressly written in the request that we take full responsibility for this unregistered product. And they complied naman with all of those requirements, and it was granted. And it was only granted really to the PSG.
Well, Doc, another issue there sa PSG vaccines is the issue of priorities. Yung families of the PSG members are also included in the compassionate use, whereas that advantage is not even given to frontliners of the medical community who are facing the virus every day. And if you do remember, number one priority, medical frontliners, and number 5 ata yung uniformed services. So may konting, doesn't this throw a sledgehammer, not even a wrench, a sledgehammer to the priority list?
Well, I wouldn't give the compassionate special permit if I thought I was taking a vaccine away from anybody who deserved it more. Kasi this vaccine would not even be used in the Philippines because it's not registered here. Nobody can bring it in, unless a doctor says, okay, I'll take full responsibility for it and I'll give it to my men or something. And sila lang naman talaga yung gumawa nun. Kung hindi naman natin sila binigyan ng compassionate special permit for it, wala namang gagamit ng bakunang ito, hindi naman siya magagamit sa Pilipinas. So, it's not part of our public immunization program. May nag-donate sa kanila and they're willing to take the risk and use it. Pero yung bibilhin ng pamahalaan, ito hindi natin ginastosan to, yung bibilihin ng pamahalaan at saka yung kasama sa programa natin, of course that will follow the prioritization list that has been set.
Okay, Usec, quick question. Yung po bang compassionate use, particularly dito sa PSG, retroactive po ba yan?
Hindi po. No, definitely not. No, there's no such thing as a retroactive permit. No,
Okay.
It only covers what will be a one-time importation of a donated product.
Okay, but Usec, you know why I'm asking, of course. This is also to follow up on, so does this mean that the investigation on the shots that some PSG members already got prior to all of this, the investigation is ongoing, and for that matter, meron po ba tayong update dyan?
Well, ganun pa rin naman. Sumusulat pa rin naman si Secretary of Health. Sumusulat kami asking for information, and so far it's been a blank wall. No? But our staff, our enforcement unit is working with the Bureau of Customs and checking lahat ng mga dumating ng mga September, October. Naghahanap kami and looking for leads. But,
Yes, sir.
I don't have any useful information. I'm not getting any useful information.
Well, Doc, that's useful in itself. Kasi I remember you told us that you wrote to Secretary Lorenzano, so hindi na sumagot at all since then yung DND, doon sa inquiries from DOH and FDA.
Yes, in fact, the Secretary Duque also wrote them, give us a list if you've vaccinated anybody, and then so we can watch out if they're getting any adverse events, if they're getting any
that should be part
side
of it.
effects. Yeah, walang reply.
Wala bang liability yon for stonewalling? That's a public health issue. Diba? And
you want to
kinonfirm
monitor them.
recently nila na it's Sinopharm. Kinonfirm na yun ng gobyerno natin that they use Sinopharm. Anong status ng Sinopharm ngayon?
Wala. Sinopharm, like I said, has not applied for permit here, but it is the donation that they're going to get from from China.
So may law ba na na-violate? Is there any specific law na na-violate sa ginawa nila? Is there any accountability? Kung sakasakali lang na dumipas na yung utos ng Presidente at Commander-in-Chief na don't talk to anybody, pwede pa rin ba silang maging liable for breaking any law, any regulation?
Well, smuggling is illegal in the country. No, bringing in a product without a permit or without a registration is a crime, and using a product that is unauthorized is also that they do have liabilities for that. Yes.
So Usec, we assume that they're not gonna get any second shot from, say, Pfizer or AstraZeneca moving forward. Wala na yun.
Wala
Hindi
na
na sila,
yun, oo.
yeah. Okay.
Hindi naman kasi right now there's no there's no data that shows any interchangeability of vaccine. So if you get one, you get 2 doses of that, and that's it. We don't advise getting a vaccine of another kind later on.
But
So-
what if Sinopharm has a low efficacy rate? I mean, does that change the picture in a way? Because in effect, you have what, 20,000 PSG people there that may be infecting who knows who, right?
Well, we will know by next year if people are going to need booster shots. No? Kasi talagang we know the history of COVID is only 1 year. So, and the history of vaccines is about 6 to 9 months of all of the vaccines. So at this time, all we know is that, for 6 to 9 months, you're probably protected from getting an infection, but we don't know how long that lasts. So this is really science in development. We're going to find out more as we go along.
Usec, I hope you don't mind, but it's really, we really empathize with you. But it's also really troubling where, as you said, there's stonewalling and you're not getting any information on something of real importance. Are you saying that you cannot even, we don't even know yet how it was brought in, at which port, who brought it in, which doctors administered it? So, more than a month after lumabas tong balitang to?
Yeah, I can honestly tell you that I have no idea where it passed through and how it got there. It has been very persistent, we know that. Talaga namang kaliwat kanan ng balita, but I cannot get any straight answers, and I don't even know how many people, if any, were actually injected, It's hard. It's very difficult. But at least now I know if people are going to get vaccinated, they're going to get listed, and I'm going to find out if anything bad happens to them, and somebody's going to be responsible for it.
Pero doon kasi
In the
importante
meantime,
yung
on track ba yung February 23, which was announced by the government? Dadating na ba?
I don't know, Ami. No? Like I said earlier, I cannot assure an EUA decision by February 23. I want to make a decision before that, whether it's a positive decision or a negative decision. But some documents are still pending. My experts are still out. Like they said, the jury's still out on this, and I haven't gotten any feedback. It's also, I think everybody's really having a very difficult time reconciling kasi everything. Like the clinical trials, for example, happened in 3 different places, di ba? Meron sa Brazil, tapos meron sa Turkey, tapos meron sa Brazil na 50% ang efficacy, pero sa Turkey, mataas, 90%. Pag ka kasi when you're a trialist and when you're a scientist, you have to make sense of it first before you accept it. And it's really it's not as easy as people think.
May liability ba kayo in case you approve it tapos may nangyari na masama din sa mga recipient?
Well, no naman. No. I think I've been told
Good
last
faith
night
naman. In good faith yung kanila.
And it's in the performance of my official duty naman to make a decision. Because the thing is, I can also just stop making decisions and have no vaccine available, But hindi naman kaya ng puso ko yun.
I-push nyo na lang na may indemnification
Yes.
sakaling may adverse effect.
Oo, I think they really work with.
Masama kayo sa demanda, pareho sa dengbak, kasama lahat.
Kaya nga, it's so difficult to get experts, for example, to help you with this. No? We don't pay them; they're volunteers. But it's so there are like hundreds of experts in the country, but it's so hard for us to get. Kasi takot na takot lahat na paano kung ihabla ka, but we're doing our job. We're trying to make the best decisions that we can for everybody.
Well, Doc, I do remember earlier you said na it's important to monitor those who are vaccinated early on, yung PSG examples last year, it's important to monitor them to see how they are and whether they're getting infected or whether they are getting vulnerable again, kasi we don't know how long the efficacy is. But given the fact that they're not responding to your queries, I know you said merong liability yan, but is the FDA considering going after these persons? I mean, is that even on the horizon, or it's a bit too far out?
No, we're really waiting for somebody to come out, especially if something, I mean, bad happened. No, we'd like to find out. Pero yun nga, it's getting difficult to get information. At least, and it could be useful information. We could find out that it's 100%
I mean, kasi
effective and nobody got sick.
Yes, Doc.
So,
I mean, kasi you can file charges if you want
at
to.
least we will be getting that information from now on.
Opo. What I mean is that you can file charges if you see the need to, because these are violations of the law. I was wondering lang if you were headed in that direction, and if you have a cutoff by when you would decide on whether or not to file or pursue charges, if that is the case.
Yun yung hinahanap talaga nila. Actually, ang hinahanap nila is from the start of when it got in and then who's responsible, di ba? Yung smuggling side and then who distributed it. So, once we find them, if we identify anybody, our enforcement unit is allowed, has quasi-judicial powers and they can also file criminal cases. Yun nga, talagang hirap pa kaming mag-pinpoint kung sino yung aming ihahabla.
Okay.
Otherwise, baka kayo ang mahabla. Yan ang problema.
Yun nga po talagang it's a very difficult position, but you just have to take a look at everything objectively, and follow the process. That's what I just keep saying to myself. There's pressure on this side, pressure on the other side, but take things objectively. Look at the documents if they're complete. Look at the safety and the efficacy. If it's acceptable, then approve it. Kung hindi talaga, hindi. Talagang it's the only way to go.
Now, in the meantime, Usec, another thing that government, of course, is monitoring is the problem with fake and counterfeit vaccines floating around there. Anong development dyan? What are you seeing, and are we keeping a lid on it?
Yes, we expected this na once nung mag-start pa lang tayo maglabas ng EUA, alam na natin yan. Pag nag-start pumasok ang vaccine, dyan din papasok din ang fake vaccines. So we've been working very, very closely now with Bureau of Customs. So kahit anong vaccine ngayon, pag dumating, tinatawag nila sa amin, tapos sinisilip namin kung anong laman. Kasi talagang maraming fake. Nahuli na nga sa China. They found the makers of fake vaccines. And probably a lot of those people who got vaccines allegedly in Binondo a few months ago, possible talaga na dyan nanggaling yan. And there's no vaccine that's for sale that's authentic. Everybody has to realize that. In the whole world, there's no commercially available vaccine. So if somebody's selling a vaccine, it's either a fake vaccine, something that's been a substandard na itatapon na dapat, tapos ibinenta. Kasi walang commercially available vaccine at this time. And we need the help of the consumers. Kung bibili ka naman, tapos isasaksak mo sa sarili mo, parang ayaw na kitang pigilan. Kung bibili ka sa black market, tapos isasaksak mo sa katawan mo. I mean, we need to be all judicious about it. But we're working with the police, the NBI, and the Bureau of Customs, and right now every suspicious-looking freezer vaccine they report to us, and we send our agents to take a look.
Yung sinabi ni Tessie Angsina, about 100,000 Chinese have already been vaccinated in the Philippines. Do you have any new leads on that story?
Well, from what we learned kasi from the Chinese government is that all of their foreign workers, parang OFW nila, yung overseas Chinese workers, they vaccinate them before they come here. So, yung standard na nila ngayon. So, that might be it. Yung mga nabakunahan, talagang karamihan ng mga Chinese workers na nandito were vaccinated previously before coming here. Pero after that, we had a crackdown in some clinics in Makati, and then in Binondo with also the police of Manila, Sadang Maynila. Wala namang nahuli, walang makita mga bakuna. Either sobrang bilis nila talagang magligpit at saka tumakbo, Pero, I'm afraid a lot of them, kung meron man, were probably given fake vaccines.
Side of
Doc, before we let you
vaccines,
go,
Sir, yeah.
sige po, go ahead.
Usec, wag naman vaccines, drugs naman. Are you studying or at least checking on certain drugs against COVID or to fight COVID? Halimbawa, itong mga bagong pumapasok na, of course, yung ginagamit din sa lupus.
Blood thinner.
Yeah. Are you studying new drugs at least? Meron bang ganon?
Yeah, we have the Philippine Society of Infectious Disease. They're the ones who give the parang guidelines on what drugs can be used right now. So they keep us updated. And of course, the DOH keeps everybody updated about the current guidelines. So marami talagang tinitest. Some of them are new drugs, like old drugs like the blood thinners, the steroids that are being used now. And some of them are new, na itong sila remdesivir, pero may mga bago na ngayon na mga monoclonal antibodies. So this one, we let the hospitals bring them in on compassionate special permit. Basta, kasi hindi pa register dito sa atin eh. So yung hospital usually, we allow them to stock up for 1,000 to 2,000 patients, and then as they use it, they report to us the utilization.
Doc, si Presidential Advisor on Entrepreneurship, Joey Concepcion, said that AstraZeneca and Moderna are no longer taking in new orders kasi they're running out of stocks. So there's quite a lot of concern about that kasi, apparently the country has not even finalized yet any order for drugs, aside from yung order natin with COVAX and yung order ng private sector. So where does that leave us po?
So yung AstraZeneca, I think, has capped the Philippine order to 17 million.
Yun po yung private sector.
Heard from Secretary Galvez earlier today. Yung Moderna, I think they're getting 10 million. No? That's why we're really looking for several sources. Kaya lang, talagang kailangan pumasa naman sa standards natin yung sources na yun. No? Kaya we're looking at, of course, Sinovac is being considered, Sputnik, and then yung Novavax. Janssen is also very optimistic tayo dyan kasi baka pwedeng single dose. That would be so much easier to use. No? Si Janssen, tas yung Novavax from the Serum Institute of India. So we're taking a look at all of these and hopefully yung iba sana mag-apply na. I think Moderna might be applying soon and maybe Novavax.
Okay, FDA Director General Eric Domingo. Doc, maraming salamat for joining us. Always a pleasure to have you with us.
Salamat,
Thank you,
Usec.
sir.
Ingat po.
Thank you.
Thank you.
We'll just go into a break, so please stay with us.
Vaccines are. Carlito Galvez admitted that they're expecting vaccine supply problems to continue throughout the first half of the year. This as European countries in the US are also scrambling to get their share of shots, especially of the Western-made vaccines.
Just in case na magkaroon po tayo ng influx, malaki po ang storage natin sa ating mga third-party provider. Yung sa ating sa RITM, may mga limitation hanggang ano po yun. More or less 1 million lang po ang kaya sa Pfizer, and then sa Moderna very limited. So ang ano po namin, magkaroon po ng third-party storage.
Vaccine makers AstraZeneca and Moderna will stop taking in new orders for their COVID-19 shots, at least for now.
The 17 million doses that the private and the LGU order is on track to be delivered on time. Yung 2.6 to 2.8 million will be first, no? May and June yan. Yung balance nun will be in the third quarter.
Welcome back to the Chiefs here on One News. We are now in the final stage of our conversation. Now joining us is Department of Health spokesperson Undersecretary Maria Rosario Vergeire. Usec Vergeire, welcome again to the Chiefs.
Good evening po.
Good
evening.
Ma'am, let's start po with the recommendation of NEDA. NEDA is recommending that the entire country, including Metro Manila, of course, be placed under MGCQ. Is the Department of Health on board with this? And was this your recommendation also?
We're part of the IATF, and in the IATF, this has been discussed. But we have emphasized that there are parameters that we use for us to be able to classify an area or a specific region as to what community quarantine classification will be. So there should be this the number of cases and also the healthcare capacity. And aside from that, we emphasize that local government should be able to show that they are already capacitated to do the gatekeeping that they should be doing, like surveillance, contact tracing, isolation, and quarantine.
Okay.
So how feasible is this? How feasible is a nationwide MGCQ, as NEDA Acting Chief Carl Chua suggests?
Well, as long as we can see that local governments can be able to manage already, because even during the start of our community quarantine classifications, we have always emphasized that the local governments have that authority to do localized lockdowns. And this is really the direction that we will do granular response so that we can be able to better manage the situation. But before we can do that, we have to specifically determine if local governments can be able to manage already.
But who determines that po? Can an LGU declare that for itself, or for that matter, swinging the other way, can an LGU opt out of MGCQ?
It is not the LGUs which decides if it's going to be this community level quarantine like the ECQ, MGCQ. It is the IATF. What local governments has authority will be for them to declare localized lockdowns. For example, in their area, there's a specific barangay which has cluster of cases. They can declare the lockdown in that specific barangay or even in just the street. But for the wider community quarantine classification, it is IATF which declares that.
Yes, ma'am. But ma'am, in the end, ma'am, everybody would prefer to listen to...
as young as 5 years old to be able to go out again. Is the Department of Health in favor of this?
Well, the experts have said if we would want to go into this direction, we should do it gradually. Cannot just do it. We say that it's going to happen already in this coming March. We have to see the situation because we know how vulnerable children are.
Ma'am, let me just fine-tune the questions kanina and try to focus it a bit. Kasi in the end, everybody would prefer to listen to the health experts. Of course, the IATF will have one thing, will say one thing, the LGs will say another thing. In the end, we go back to the doctors and the DOH. As far as the DOH po is concerned, do you see the country meeting the requirements to go down to MGCQ? We understand po the criteria set kanina, pero in the end, when you assess everything, and I suppose it will be an assessment by DOH anyway, does it qualify the country?
Well, if we look at the numbers right now, we can see that the numbers in the National Capital Region, for example, has been plateauing. It is not really, the cases are stable, but we can see some cities which have increasing number of cases, as well as in the other areas in the country. So what we are looking at right now, as I've said, this MGCQ is really something that we would want also from the health sector, because we know we need to balance this with the economy. But we said that it has to be that the local governments are also prepared, because once we loosen up these restrictions across the whole region, the local governments have to step up. They need to have a better surveillance system. They need to be quarantining and isolating properly, and they need to do screening across their borders, no, so that we will be able to prevent further transmission. And one of the things that we have emphasized would be the vaccines are coming. We need to keep the cases low so that our population will be prepared and we will be able to implement it properly and it will be effective across the population.
And exactly po, that's something also that we've been hearing from mayors yesterday and today. Precisely, for them, the biggest context is, yes, they understand the need to balance, as government keeps saying, lives and livelihood. We're trying to save both. But they stand at that intersection, the LGUs. You could argue that nobody feels that at ground level better than them. Pero yung mensahe nga po nila is precisely what you said. Parating na yung vaccines eh. Isn't it a bit ironic na yan na yun, tanaw na natin eh, abot tanaw na natin yung bakuna, pagkatapos ngayon pa tayo biglang magmamadali to try to go back to MGCQ. I mean, is there, does the DOH agree with the validity of that plaint by our mayors?
Well, we recognize the value of the inputs of our mayors, because I agree with them and I agree with you that they are the ones experiencing it on the ground, and they are the ones really strictly implementing all of these protocols on the ground, and they can see the situation. Our experts are recommending that we do this gradually. Actually, before this IATF, we were also planning already into this new normal shifting, where we shift all of the areas into MGCQ. But in that time period where we can see, as I mentioned a while ago, when local governments are capable already.
Usec, how much leeway do local governments have? Because yesterday, Mayor Marcy Teodoro of Marikina issued an executive order against the order on the reopening of cinemas before the order was withdrawn by the IATF. Are they allowed to go against IATF recommendations?
Well, I'm not a legal person, ma'am, but as far as I know, the hierarchy would be the IATF is a policy recommending body to the Office of the President. So if the Office of the President will mandate this kind of protocol, and then everybody has to follow.
Actually, ma'am, yung pinupuntirya rin nila, yung process, no? They're saying that the IATF guidelines also are communicated to them after the fact, no? And they hear about it only, I suppose, media, no? So pati sila, they're caught flat-footed by the new guidelines. So what we want to know is exactly what the process is. Do you consult with them first, or do you come up with guidelines apart from their recommendations? How does it really work?
Yes, ma'am. Actually, when we had that IATF meeting, the Metro Manila Development Authority was there as a representative for the city mayors of Metro Manila. And it has always been the practice that they are there, and they are part of the consultative process. Now, when it comes to IATF, the agreement would be that IATF will decide, and then there should be specific guidelines first before we announce it, so that, or we announce it, but before we implement it, specific guidelines should be there. So with these specific guidelines, you will have safeguards for health. You will have safeguards for the other sectors, so that everybody will be clear that this will just be implemented if the health protocols will be ensured. So that is the process. So during the time that they decide in IATF, everybody is represented. And when the time comes after the IATF, it is being announced by the Office of the President only after the President would say yes. And whenever there are these guidelines that has to be done, it is supposed to be that the implementation should start after the guidelines are issued.
Okay. Now, ma'am, moving on to another to another topic. AstraZeneca is saying they're having to put a cap on orders right now, acknowledging what people have been saying all along, that there's going to be some supply issues here. Now, this runs up against basically our question is will this affect our orders? Because this runs up against the news as well na there is still no formal hard contract or order in place. Where does that news from AstraZeneca and our situation put us as far as the schedule of expecting our vaccines?
Oh, well, it has always been mentioned by Secretary Galvez that there is this commitment already from these different manufacturers. I've heard Usec Domingo saying about the number of doses that has been committed to the country. What we are expecting right now from AstraZeneca would be the one that was committed by the COVAX facility, which is about 5 to 9 million. And aside from that, having this bilateral negotiation with AstraZeneca, they have committed to us at least this 10 million doses of vaccine. So if the commitment has not changed, then we can get it. But as what Secretary Galvez has mentioned, we might have a challenge for these first 2 quarters of the year. But definitely, start the 3rd quarter, all of these commitments will come in.
But are we actually expecting any vaccines this month? Because Malacanang seems certain that something will arrive on February 23. Well, specifically the Sinovac. And they are still optimistic that within the month, merong dadating from the COVAX facility. Are we still on track on these timelines?
Oh, well, the Sinovac donation, the Chinese government is donating 500,000 worth of doses of Sinovac vaccine, and it has been committed that it will be arriving on February 23, as what Secretary Galvez has mentioned. But everything will be reliant also on the regulatory process. The Sinovac has to undergo the evaluation, which FDA is doing right now, and it has to have the EUA before we can be able to accept the donations. As to the Pfizer vaccines, the 117,000, which was, we had an indicative date of February 15 before, but due to the indemnification agreement negotiations, it has been delayed. But we were already able to give the submitted finalized version of this agreement according to the negotiations, and we are just waiting for their response.
So how much of a delay will all of this cost us if, for example, the EUA for Sinovac is not granted by the 23rd?
Oh, well, as we have said, we are not going to accept donations if there is no EUA. So it will depend on the evaluation of our experts and the Food and Drug Administration. The FDA has a timeline also as to how many days they can process an EUA because it is supposed to be expedited. So if ever that the Sinovac will not pass the stringent regulatory process of the government, and then we have to wait until they can submit further documents to prove that they can have this EUA. As to the COVAX facility, we are just waiting for the response. Once it is acceptable already to them, this indemnification agreement, then the supplies can be shipped already to the country.
Ma'am, may I ask you about something that Usec Domingo mentioned kanina? Because we asked about the investigations into the vaccination shots that were administered to the PSG some weeks back. And he said, to be perfectly honest, he said, and Secretary Duque, we have been following up with Malacanang. We have been asking the DND for information. Bottom line, there has been stonewalling. Bottom line, we do not know anything at this point. What is the stance here in the position of the DOH when this is clearly a very important public health matter? And can you confirm that Secretary Duque and the DOH have essentially gotten nowhere in trying to get to the bottom of who brought in these shots?
Yes, that's true. We had been trying to get all the details so that at least we can monitor these specific individuals who were given with this vaccine, the donated vaccines apparently. But up until now, we have not received any information yet.
But ma'am, I suppose...
What's the latest situation on the UK variant? Have we been able to establish whether there's local transmission or community transmission anywhere in the country?
Yes, ma'am. We were able to identify or detect additional 19 individuals with this UK variant, and we were able to release this over the last weekend. As to local transmission, we were able to already declare a local transmission in Car region during the time that there were these specific individuals who were detected with the virus in Bontoc province, Mountain province. Now, as to these latest cases, there are still no final details as to if we have community transmission, if we have local transmission. We are still doing the contact tracing. We are still doing further investigations, especially for those that have traveled from their areas of residence, going to Manila and then going to other places. So we will have that information hopefully towards the end of the week.
Do you think the presence of the variant should be a major factor in considering the proposal of NEDA? Because this is also what the Octa research is saying. And you mentioned today that in 8 cities in Metro Manila and 3 regions, COVID cases are still rising. So are you going to present this to IATF?
Well, yes, ma'am. It's always a factor when we talk about the variants because you know that variants have higher transmissibility. And therefore, if they have higher transmissibility, the threat of the rise in cases would be there. And we are seeing an increase in the number of cases in certain areas of the country, specifically those areas where we detected variants. So it will be something that has to be considered. But I like to share to all of you that during the time that they wanted to expand the age group and lower down the age group that can go out, we already tried to have that position in IATF so that they will not implement that at once during that time because that was the time when we detected the first batch of these individuals with the variants. But now we also said that, and of course, the economic sector would say that the variants that are here, we just need to have safeguards. And actually, ma'am, based on my opinion, the variants are highly transmissible. But we also need to consider the economy. So I understand their point of view. But what we are trying to say from DOH would be safeguards should be there. And so if ever we are going to open up the other sectors or if ever we are going to shift into MGCQ, our safeguards should be there. And one of the primary safeguards for health would be that local governments will step up, that they will be able to have a better surveillance system. They should guard their borders. There should be proper isolation and quarantining procedures.
Okay, Health Undersecretary Maria Rosario Vergeire. Ma'am, thank you for joining us tonight.
Thank you.
Maraming salamat po.
Usec.
And that'll be all for this Tuesday edition of The Chiefs. We hope what was discussed here will keep the conversation going. I'm Edlin Gao.
I'm Mami Pamintuan of the Philippine Star.
I'm Lucy Cruz Valdez of News 5.
I'm Robbie Alampay, and we are One News.